back to Coffee and Coverage. My name is Nicole, and I'll be your host. And today we are joined with Marantz, who's one of our benefit consultants here at Pinnacle. Hi, Marantz.
Hello.
All right, so we have a new topic today, and today we are going to be discussing Medicare and what you need to know if you turn 65 but you're still working. All right, you ready?
I'm ready.
Okay, so a couple of questions. We'll start with this one. Do you have to enroll in Medicare if you are still working at the age of 65 and older? So as an example, if you have coverage from your employer, how would that work?
So if you have qualifying health coverage and prescription drug coverage from your employer, there's no need to enroll in Medicare.
Okay.
Also, something that you need to kind of know, if your employer has 20 or less employees, you will need to enroll in Medicare Part A, as that will be your primary for hospitalization.
And will that automatically happen, or is that required of the employee?
So you'll have to enroll in that. Unless you're pulling Social Security, then that's going to be an automatic.
Okay. So what about if you're turning 65 and you're self-employed?
Okay, so that's going to depend on if you are maybe, on exchange on the marketplace getting subsidized or those tax credits, or if you're off exchange, so directly from the carrier.
Okay.
If you're on the marketplace, you're going to have to enroll in Medicare and transition to Medicare the first day of the month of your 65th birthday.
Right.
If you are off exchange directly through the carrier when you're self-employed, then you can continue to stay on that insurance, but it's going to be a lot more spendy than just going to Medicare.
Right. So at that point, you're probably better off to enroll in Medicare anyways.
Right. Yeah.
Okay. So could you be penalized if you continue working and don't take Medicare and stay on your group plan?
So where you could see penalties would be, if you enroll in any parts of Medicare, Part A even, and you have 20 or more, and you are contributing to an HSA, you can get penalized for contributing to your HSA at that point. So if you'd like to still do that when you're working, don't enroll in any parts of Medicare. The other part where you could see a penalty is if your prescription drug coverage isn't up to par with a Medicare prescription drug coverage plan, then that's where you could also see a penalty. So you want to make sure that you have that qualifying drug coverage on your health insurance plan.
Okay. So just because I'm curious too, how do you know if your employer plan is compatible with Medicare's Part D plan?
Yep, so that's something that you could ask your employer, your HR. Also, there are some plans that do offer, so if you have a high deductible health plan, there are no co-pays for prescription drugs. There are some carriers now that have implemented like a value-based or preventive drug list that does have some coverage on prescription drugs. So that's going to actually help you in having that qualifying health cover or prescription drug plan. Okay. So there's ways that the insurance companies are kind of implementing things to make sure that you're where you need to be if you're going to continue to work, I guess.
Okay. Very good. Anything else that you can think of to add if somebody wants to continue working over the age of 65?
I would say, everything is situational. So always good to just kind of give us a call, run through your specific situation, and then we can kind of take it from there on what you need to do next.
Sounds great. Well, thank you, Marantz, so much for joining me today. And remember, everyone, coffee is optional, coverage is not. See you next time.